Hi, and welcome to OS2U Training and Development Center presents Coding Courses, a guide through OS2 coding programs and pricing. Today we will be discussing each of the topics listed below: who we are, why you should consider OS2U, our affiliates and partners, what risk adjustment coding is, and an overview of our programs as well as costs and enrollment. OS2U was founded in 2015. Our goal is to coach coding professionals to be compliant in coding practices. We offer affordable, comprehensive medical coding training programs, and our courses are designed for certified and non-certified medical coders alike. We are an AAPC-approved education provider with incorporated AHIMA domains. We are also approved through programs such as MyCAA, Vocational Rehab, and GI Bill. If you choose a job you love, you'll never have to work a day in your life. It is our hope that you can create the coding career of your dreams with us at OS2U. Our affiliates and partners are listed below. Each of these entities work with us hand in hand to provide everything from quality education to employment opportunities. Here at OS2U, we offer a variety of programs to assist you in your coding career. From coding programs to training practicums and certification bootcamps to self-paced courses, we've got something for you, whether you are an unemployed, underemployed, or experienced coder. So what exactly is risk adjustment coding? As a coder, you are responsible for coding all of the diagnosis that affects the patient's mortality by capturing all of the codes that risk adjust for the previous calendar year. This ensures patients with more adverse health conditions receive quality care without expensive premiums. Risk adjustment practicums are 10 weeks long, and you can earn up to 40 CEUs. Our practicums are simulated charts and guidelines that provide students with the skills needed to master proficiency in risk adjustment coding. They are ideal for novice and experienced coders. Our practicums work as follows. Each practicum allows students to apply the skills that they've learned in previous coding courses in a supervised setting to gain practical experience in various disciplines. Practicum 1 is in HRAs, or Home Risk Assessment. Practicum 2 is in HCC, or Hierarchical Condition Codes. Practicum 3 is in Practicode, an AAPC training program. And Practicum 4 is in CCC, Complete Code Capture. Our practicum program details are as follows. Student enrollment is limited to 30 students per session. Coding certification or registration from AHIMA or coding certification from AAPC is required. We encourage prospective students to check for discounts and scholarships to attend at our website, and info sessions and registrations are to be completed in a timely manner. Practicum tuition is only $500 and is due to OS2U 2 weeks prior to course start date. Supply costs are due to AAPC and can be found at their website. For the practicums, you will need the AAPC coding manuals for both 2019 and 2020. We have an easy enrollment process that begins with students registering for an info session. Then, at the end of the info session, OS2U will share a post-webinar survey for those who wish to express their interest. Once completed and returned to OS2U, we will send the student an enrollment agreement and an invoice for their tuition to be complete. Once the student has paid their tuition and completed all OS2U enrollment forms, a welcome letter, which includes orientation info, will be sent to the student's email 2 weeks prior to the start of the course. OS2U also offers medical coding bootcamps, which boast a 94% first attempt pass rate and earn students 16 CEUs. While OS2U bootcamps are not a full coding course, they serve as valuable prep courses to prepare students to sit for their AAPC exam. We focus on test-taking tips and learning how to tab resources appropriately to improve time management when finding the answers needed for testing. Our coding bootcamps are outlined as follows. Bootcamp 1 is for CRC, where a certified risk adjustment coder has proven they know how to read a medical chart and assign the correct diagnosis codes. Bootcamp 2 is for CPC. The certified professional coder credential validates your knowledge of CPT, ICD-10, and HCPCS Level 2 coding skills in a physician setting. Bootcamp 3 is for COC. The Certified Outpatient Coder, formerly CPCH, provides the principles of facility coding for the hospital and ambulatory surgery center settings. And finally, Bootcamp 4, CIC. The Certified Inpatient Coder is the only credential dedicated exclusively to inpatient hospital and facility coding offered by AAPC. Here is an outline of our Coding Bootcamp program details. Student enrollment is limited to 30 students per session. You must have completed a coding course or have attempted a certification exam and obtained the most recent certification study guide and coding manuals from AAPC. You also will have obtained a certification exam voucher from AAPC. Tuition for the Coding Bootcamps is $250 for each course and is due to OS2U 2 weeks prior to course date. Bootcamp supplies typically are the study guides, coding manuals, and exam vouchers respective to the bootcamps you're signing up for. Their costs vary annually and can be found at AAPC's website. Course totals are consistent with those who have already obtained their membership through AAPC. To enroll in Coding Bootcamps, students will follow this timeline. First, students will complete the Smartsheet link to express their interest in a bootcamp course. Then, OS2U will send the student an enrollment agreement and invoice for their tuition to complete. Lastly, once a student has paid their tuition and completed all OS2U enrollment forms, a welcome letter, which includes the orientation info, will be sent to the student's email 2 weeks prior to the start of course. Kindly visit our website to view our updated calendar showcasing start dates and course frequency. Get the most of your training and save money by bundling a practicum and bootcamp to illustrate your coding proficiency. For more information about the total cost to include supplies, please refer to the OS2U brochures or website. OS2U is also known for its Coding Mentee Programs. These programs are provided in 2 phases and give the students the opportunity to earn up to 3 coding certifications. Our Mentee programs provide students with the fundamentals in coding, practical experience, and even a paid internship upon completion of earning their first certificate. Here's how it works. The first phase is in risk adjustment. It is a 6-month on-site course for students in Bell County. Students learn the fundamentals of diagnostic coding guidelines and practices, along with the principles and purpose of risk adjustment coding. Students will then go through a 4-day boot camp and sit for their CRC exam at OS2 Practicum, where students will code 500 simulated home assessments and 250 charts in retro risk adjustment, following CMS rules modified by some of the largest plans' common guidelines. After earning CRC credential and successful completion of the practicum, students are offered a paid position with sister company OS2 Healthcare Solutions to assist with coding on their risk adjustment projects during peak season. The second phase is in outpatient coding for both hospital and physician coding. It starts immediately after peak season and is an 8-month on-site course designed to prepare risk adjustment coders in the discipline of procedural coding in the physician and hospital setting, all in an attempt to earn your CPC and COC certifications. Students who meet the requirements for Department of Labor apprenticeship program will still be paid while attending training at least 30 hours per week while working for OS2 Healthcare Solutions. Our Coding Mentee programs are listed here. Student enrollment is limited to 48 students a year. Successful completion of medical terminology, pharmacology, anatomy, and physiology courses are required. Students must live within 50 miles of OS2 HCS, attend on-site mentee info session, and interview with 2 letters of recommendation, as well as pass a background screen and drug test. Course costs for both phases of the mentee programs are listed as follows. Tuition and registration for the Risk Adjustment Mentee program is $3,860 due to OS2U 2 weeks prior to course start date. Supplies required are listed below and vary in pricing dependent upon AAPC's most recent costs. You can find this information at their website. Email OS2U, attend an info session, or view our website to apply. Tuition and registration for the Outpatient Mentee program is $4,060 due to OS2U 2 weeks prior to course start date. Supplies required are listed below and also vary in pricing dependent upon AAPC's most recent price list. You can find this information at their website as well. The enrollment process is simple. First, students who are interested in the Mentee program for 2020 must attend or listen to a 2020 Coding Mentee info session. This takes place via GoToWebinar on Thursday evenings from 6 to 7 p.m. Central Standard Time. If the potential student is unable to attend the informative webinar, upon registering they will receive a copy of the recording. They may request the recording to be sent to them as well. Then, students will complete the post on-site survey form to express their interest in the Mentee program after completion of the info session. Next, OS2U will send the student an enrollment agreement and invoice for their tuition to complete. Finally, once the student has paid their tuition and completed all OS2U enrollment forms, a welcome letter that includes orientation info will be sent to the student's email 2 weeks prior to the start of the course. OS2U offers 3 types of self-paced certification courses as well: risk adjustment coding, hospital outpatient coding, and physician outpatient coding. These courses are available to anyone looking to become certified but unable to commit to scheduled class dates. Students will have 12 months to complete the course, and during the course, students will have access to recorded lectures for each domain. These courses follow a rolling admission starting in January 2020. We also have CPMA and inpatient courses coming soon. Here is how our self-paced programs work. First, students will have access to live Q&A sessions to go over each chapter. In addition, students will have the ability to attend 5 one-hour tutoring sessions. Plus, our training approach features domain review, test-taking tips, and discipline-oriented notes. Lastly, our courses also feature a tabbing system to speed up coding search. Objectives for the self-paced programs are imperative to meet. We are committed to helping students meet the following objectives for each respective course. For risk adjustment, students will learn principles of risk adjustment and accurate diagnosis coding, study predictive modeling and the financial impact of risk adjustment coding, identify documentation challenges, and review and adhere to official diagnosis coding guidelines and diagnosis coding in ICD-10-CM. For physician outpatient coding, students will learn about the principles of physician coding being based on professional services provided by the physician rather than resources used during the patient encounters. This also prepares students for a career in medical coding for a physician's office. It includes principles of CPT, ICD-10-CM code sets, and HCPCS Level 2. And finally, for hospital outpatient coding, the objectives are to learn principles of facility coding for the hospital and ambulatory surgery center, prepare students looking for a career in outpatient hospital and facility and ASC settings, identify key principles of CPT, ICD-10-CM code sets, HCPCS Level 2, and outpatient prospective payment system. Tuition for the self-paced programs are listed below for each course and are due to OS2U 2 weeks prior to course start date. Supplies are also listed and to be obtained respective to the self-paced courses you're signing up for. Supply costs vary annually and can be found at AAPC's website. We have made the enrollment process easy with an initial show of interest. Students will simply complete the Smartsheet link to express their interest in self-paced courses. OS2U will send the student an enrollment agreement and invoice for their tuition to complete. Once the student has paid their tuition and completed all OS2U enrollment forms, a welcome letter, which includes orientation info, will be sent to the student's email 2 weeks prior to the start of the course. We are proud to offer multiple programs and affordable options to those looking to invest in our courses. From VOC Rehab and scholarships to GI Bill, MyCAA, and most recently WIOA, we have many ways to complement our pricing, with affordable and competitive rates for those who choose self-pay. Here we have an overview of the overall cost students can typically expect for both tuition and supplies, with of course the occasional total being subject to change with 2020 pricing pending. Naturally, as you think about becoming a student or continuing your coding education with us, you'll want to hear from others who have attended. Here are just a few of the many success stories and reviews we have received here at OS2U. So why choose OS2U? We offer paid externship opportunities with OS2 Healthcare Solutions, a boutique coding firm that specializes in risk adjustment coding support. OS2 has worked with some of the largest healthcare organizations, facilities, and insurance companies for over 9 years and is recognized in the industry for cutting-edge training, coaching, and mentorship that has helped launch the careers of novice coders everywhere. Our partners are seeking skilled coders with practical training. We offer multiple payment options, host both online and on-site training platforms, and we're perfect for novice coders seeking coding experience. So are you ready to get started with OS2U? Visit our website, os2u.org/programs, or call today for more information.